Today I will talk about an important clinical topic. I will talk about two syndromes, two clinical syndromes. This speech is to healthcare professionals. It's not for the public among my fans and my followers. So this topic is for the healthcare professionals, for doctors. Because it is a clinical topic, about a clinical topic. Let me start by mentioning these two clinical syndromes. And as we all know that syndromes, or a syndrome is a medical condition which has different causes, and it has no single, there is no single etiology or no single cause. It has multiple causes, and it has different presentations with variable symptoms and signs. That's why it is a syndrome. It's not a disease. The first syndrome which I am going to talk about is what we call the Werner syndrome. And Werner syndrome, it's also called the adult progeria syndrome, or a premature aging syndrome, the Werner syndrome. هي بتتكتب بالدبليو، لكن الدبليو بتتنطق في لان الفيرنر ده شخص الماني، وزي ما احنا عارفين ان الدبليو بالجيرمان لانجوج بتنطق في، عشان كده هي بتتكتب ويرنر، لكن it is pronounced as Werner syndrome. Werner syndrome بالان، لان السندروم الثانيه عشان كده انا ذكرتهم مع بعض. السندروم الثانيه نطق يشبهها، ولكن it is Werner syndrome. ففي فرق كلينيكالي بين الويرمر سندروم والفيرنر سندروم، أو الويرنر سندروم إذا نطقناها if we pronounce it in English. But it is Werner syndrome because this syndrome is named after the one who described it, and this is Dr. Werner, who is a German physician and German scientist, and his name is Otto O-T-T-O, Otto Werner. This is for those who are interested in the history of medicine. And as I mentioned before, history of medicine is very important, mentioning those great physicians who had their imprints and their effects and their repercussions on the medical profession. So it is described by Otto Werner, and it is the status of premature aging syndrome، أو اللي احنا بنسميها الادلت بروجيريا syndrome، علشان نفرقها من التشايلدهود بروجيريا أو التشايلدهود premature aging syndrome اللي احنا بنسميها هاتشنسون جيلفورد syndrome. ودي هذكر الفرق بينها وبين بس هتكلم الاول على الفيرنر، وبعدين هقول ايه الفرق بينها وبين الفيرنر اللي هو الادلت بروجيريا، والهاتشنسون جيلفورد سندروم اللي هي التشايلد هود بروجيريا او التشايلد هود بريماتور ايجينج سندروم. هما الاثنين كاركترايز باي بريماتور ايجينج، يعني شخص بيبدو ان هو يكبر قبل الاوان in Arabic, in simple Arabic. يعني the people or patients, those patients who either have the Werner syndrome أو those who are having the Hutchinson-Gilford syndrome, they are characterized by premature aging. وكلمة بروجيريا يعني the premature aging. If it is in the adults, we call it the Werner syndrome. If it is in childhood, we call it the Hutchinson-Gilford syndrome. الفرق بين الاثنين ايه؟ نتكلم على الفيرنر اول. start first by talking about the Werner syndrome او الأوتو فيرنر syndrome, adult progeria syndrome. And this syndrome is an autosomal recessive disease. It is transmitted as, it is a rare syndrome الأول. يعني بتأفكت مثلا one person in every 200,000 people. So it is a rare clinical syndrome. It is a hereditary syndrome. It is inherited as an autosomal recessive medical condition due to affection of chromosome 8, in contrast to the childhood progeria أو Hutchinson-Gilford syndrome اللي هي بتبقى inherited also syndrome, but affects the chromosome 1. Werner syndrome, the manifestations of the or premature aging starts to appear in those patients after puberty, in adolescence or in young adulthood. إذا بتبدأ السيمتومز بتظهر في بعد البيوبرتي، في الادوليسنس، فترة المراهقة، أو في اليونج adulthood، أو في فترة الكبر المبكرة، اليونج adults، يعني around the age of 20s. With those patients usually die around 40s or 50s. They usually die, their life expectancy is also short, but it is better than in childhood progeria أو الهاتشنسون جيلفورد syndrome، لأن في الهاتشنسون جيلفورد syndrome they usually die in the 20s. أما في الفيرنر syndrome اللي هي الادلت بروجيريا اللي هي بتيجي سن الكبر، السن المبكر اللي بيجي للادلتس، دول usually they die in the 40s or in the 50s. They usually appear or the onset of the disease of the syndrome, Werner syndrome, it is after puberty, around 20s, as I mentioned, in adolescence or early adulthood, and the usual manifestations are premature graying of hair, premature thinning of hair. There is loss of the subcutaneous fat, there is loss of the atrophy of the subcutaneous tissue. There is also changes in their mucous membranes. There is scleroderma-like changes with sclerosed skin, changes in the facial features. They have specific facial features which look like the facial features of even scleroderma, which is, but of course, as we all know, scleroderma or systemic sclerosis, which is a systemic form of scleroderma, it is an autoimmune systemic disease due to the presence of autoantibodies, which affects the skin and subcutaneous tissue. If it is limited to the skin, we call it scleroderma. If it is associated with other systemic features due to sclerosis affecting the other organs and tissues, we call it a systemic sclerosis or progressive systemic sclerosis. فالfeatures of adult progeria أو Werner syndrome, they have scleroderma-like skin changes and with thin nose and with facial characteristic facial features which look like an old age people. So the facial features or the facial appearance is like an elderly face. With, as I mentioned, loss of subcutaneous tissue and loss of subcutaneous fat and thinning and early graying of the hairs. And of course also changes in the eyes. There might be premature cataracts, there might be corneal opacification. There is also changes or affection of the bones pathologically with osteoporosis and also sometimes with aseptic necrosis of bones. And there might be also associated changes in the organ systems and the other organs. So there might also develop cardiovascular disease. They might also develop early arteriosclerosis. They might also have other associated diseases like diabetes mellitus and also increased risk of cancer in those patients. So there is increased risk of cardiovascular disease, there is increased risk of cancer, there is increased risk of premature changes in the eyes and the cataracts and these features. And they usually die around the age of 40, that is in the 4th decade or in the 5th decade of life. They don't live for long. And the progression here in adult progeria or Werner syndrome, it is rather gradual progression. In contrast to the progression of the disease in childhood progeria or Hutchinson-Gilford syndrome, which is rather rapid progression. There is rapid progressive or rapidly progressive clinical course. In childhood progeria, they can be diagnosed by any efficient clinician because the features of premature aging appear in the early years of life, usually in the 2nd or 3rd or 4th years of life. It appears very early, and the features of the disease if it didn't appear in the first few years, it must appear before the age of 10. That is, all cases appear in the first 10 years of life. And the child shows a progressive, rapidly progressive course, and they also show growth retardation and problems in puberty. And they, as I mentioned also, they usually die in around the 20s. That is, in the late second decade or in the third decade of life. This is in the childhood progeria or childhood premature aging syndrome, or what we call the Hutchinson-Gilford syndrome. This is the differences between the Gilford syndrome or the Hutchinson-Gilford syndrome, which is childhood progeria, versus the adult progeria or adult premature aging or progerian adulthood, which is called the Werner syndrome. That's which I started by talking about the Werner syndrome, which is described by the German scientist, Dr. Otto Werner. That's why we call it Werner syndrome. So whether Werner or Hutchinson-Gilford, they are progeria. But Werner is adult progeria, and the Hutchinson-Gilford syndrome is childhood progeria or childhood premature aging syndrome. This is the first part of my talk. The second part is Wermer syndrome. So خلي بالكم ان في فرق بين الورمر والفيرنر او الورنر، بس احنا بننطق النطق الصح ليها. Again, the correct pronunciation is Werner because V or W is pronounced as V in the German language, and the one who described this syndrome, his name is Werner or Werner in English. So Werner syndrome is same as Werner syndrome. It is progeria. But Wermer syndrome is another syndrome, totally different syndrome. Wermer syndrome, it is the other name or synonym of multiple endocrine neoplasia type 1, MEN 1 syndrome. And this is an autosomal dominant disease. And it is described by an American physician who is called Paul Wermer. So Paul Wermer is an American physician, while Werner, who described the adult progeria, is a German scientist and physician. So let me talk now about Wermer syndrome. Wermer, it is MEN type 1. And as we all know, MEN type 1, it is multiple endocrine neoplasia syndrome, which is one of the endocrine tumor syndromes which run in families, and they are genetically determined, and they are autosomal, or they are categorized as an autosomal dominant disease. In Werner, it was described as autosomal recessive, as I mentioned, which affects chromosome 8. Here, this is another syndrome, Wermer syndrome, or multiple endocrine neoplasia type 1, and it's described by the Paul Wermer, the American physician, in 1956, and then later also described similar features by Dr. Robert Zollinger and Dr. Ellison, also are American surgeons, who described the Zollinger-Ellison tumor or the gastrinoma syndrome due to another endocrine tumor, which is the gastrinoma, which arises from the gastrine cells in the stomach or in the duodenum or in the pancreas. And it is one of the neuroendocrine tumors, gastrinoma, and it causes what we call the gastrinoma syndrome or the Zollinger-Ellison syndrome, and it might also be associated with features similar to MEN syndrome. And this is called Zollinger-Ellison syndrome. It is different from the Wermer syndrome. Wermer, described by Paul, by a physician, American physician, before Zollinger-Ellison. زي ما قلت هو described سنة 56 ويرمر وصف السندروم اللي هو المالتيبل اندوكراين نيوبليزيا، لكن زولينجر-إليسون وصف السندروم بتاعه بعده بسنة أو بسنتين في الخمسينات برضو من هذا القرن الماضي يعني. برضو ده عشان those who are interested in the history of medicine, very important. Werner described the multiple endocrine neoplasia type 1, وده طبعا في كلنا نعرف ان all of us know that there is multiple endocrine neoplasia type 1 and multiple or بنسميها MEN MEN syndrome 1، وفي المالتيبل endocrine neoplasia او المن 2، وفي two categories منها multiple endocrine neoplasia 2A و 2B. Let us focus on the multiple endocrine neoplasia type 1. وده هنا بيبقى فيه tumors affecting mainly the parathyroid glands. في 95% من الحالات there is adenomas in the parathyroids which secrete, of course, as we all know, the parathyroid hormone. فبيبقى فيه hyperparathyroidism. It causes primary hyperparathyroidism with excessive hormone production and secretion, that is parathyroid hormone hypersecretion. وبيعمل طبعا الباراثايرويد زي ما احنا كلنا عارفين لما بيبقى في excessive secretion بيعلي الكالسيوم, and it is one of the important causes of hypercalcemia. And so all the clinical and clinico-pathological features of the parathyroid adenomas or the parathyroid tumor, which is part of the MEN syndrome, it will cause features of hypercalcemia, pathology related to hypercalcemia, whether in the bones or in the kidneys or in the gastrointestinal tract or in the cardiovascular system. All the systemic effects of the hypercalcemia due to hyperparathyroidism, and the hyperpara is due to parathyroid adenoma, and in rare cases may be due to just parathyroid hyperplasia, not a definite tumor, but hyperplastic parathyroids. As we all know, the parathyroids, they are 3 to 4 glands, different sometimes anatomically, and they lie at the posterior surface of the thyroid gland. And they are 4 small glands, as we all know, in most of the people. But sometimes they are 3. And sometimes 2 are in normal position, and 2 of them are in ectopic position anatomically, the parathyroid glands. So the parathyroid, when they have tumors, this is part of the MEN syndrome. And this happens in 95% of cases. And then come also tumors. In addition to the parathyroid tumors, there is tumors also in the affecting the anterior pituitary gland, causing different syndromes of related to secretion of growth hormone or prolactin or other anterior pituitary gland hormones. So there is tumors either producing one hormone or more than one hormone related to the anterior pituitary cells. So here we have anterior pituitary, what we call the adenohypophysis. As we all know, the pituitary, there is anterior part and posterior part. The anterior we call it the adenohypophysis, and posterior we call it the neurohypophysis. The anterior pituitary, as we all know, mainly they secrete prolactin, they secrete growth hormone, they secrete the ACTH, and they secrete also the TSH and the FSH, that's gonadotropins, that is FSH and LH. These are the hormones secreted by the anterior. So the anterior pituitary tumor may hypersecrete any one or more of those normally produced by the anterior pituitary, depending on which cells of the anterior pituitary are affected by the neoplastic process. But in anyway, it is a tumor or tumors, small adenomas in the pituitary, in the anterior pituitary, in the adenohypophysis. And the third tumors in this syndrome, in MEN type 1, Wermer, is tumors affecting the gastro-duodeno-pancreatic axis, the neuroendocrine tissue or the enterochromaffin tissue of the gastro-duodeno-pancreatic part of the gut or of the gastrointestinal tract. فهنا في tumors برضو هتطلع يا اما في الاستومك تبقى gastric او في الجيودينم duodenal tumor او من البنكرياس. It is a and whether in the pancreas او الجيودينم او السtomach, they are neuroendocrine tumors. So there is a neuroendocrine tumor in the pancreas or in the duodenum or in the stomach. These neoplasms, it is also the third part of neoplasia in MEN syndrome type 1. So don't forget, Wermer syndrome is MEN type 1 clinical syndrome, and here it is a familial disease with familial tumors affecting, number one, mainly the parathyroids, and then the anterior pituitary in 25 to 90%, and in 15 to 30 or 40%, the third part is affected by tumors is the gastroduodeno-pancreatic tissue. This is in short what is the Wermer. So don't forget Wermer, the tumors were In Wermer, the familial tumors were, and these tumors are what? They are benign. Rarely they progress to be malignant, but in most of the cases they are benign. But the problem is that they are functionally active. So they produce hormonal syndromes related to hypersecretion of hormones. From where? From number one, the parathyroids. Number two, the anterior pituitary gland. Number three, the endocrine or the neuroendocrine tissue of the gastroduodenal-pancreatic axis or gastroduodenal-pancreatic part of the gut. This is Wermer syndrome or men type 1. So don't forget Wermer versus Werner syndrome. Thank you so much, Professor Dr. Tarek Ali.